a priority in our lives. When you're not healthy, you're not able to sleep well, you're not able to work very well, you are not able to function very well.
It's another beautiful day. We thank the Lord for the gift of life and for this day. I wish to start by thanking God. I also wish to start by thanking Radio Maria, all you out there, our listeners and viewers. And as Magdalena said, today we are going to discuss a very good topic. This would be the fourth time we are doing it. Most of the programs or the conditions that we discuss, they normally come from you out there, our viewers and listeners. And this shows that you are interested and you really want to learn. So as Magdalena said, we are talking about UTI. Last week, but one, we did another condition, candidiasis. It's also an infection that presents or comes about the same way. So this is almost similar in terms of like a continuation. And in every topic that we do, I always start with an introduction. And first of all, I wish you to know that UTI or urinary tract infection is a condition that is treatable. I repeat, urinary tract infection is a condition that is treatable. Number two, there's a lot of misconception. There are so many people out there who are misinformed or who have the wrong information or knowledge about UTI. It's a condition that is affecting many women. So it's a special dedication to all our women, all our mothers, and our young girls. So for the mothers, please kindly take notes so that by the end of the day, you'll be able to know how to go about this. Misconception will come in as about, because when we talk about this condition, when a person gets this infection, it affects all of us, even men. But you find because of the way a woman is created, it more affects a woman. So when this infection comes about, you find that we have many issues in marriage, whereby when a woman starts presenting with signs, she will suspect the husband as having brought the infection, or vice versa. The man will suspect maybe the wife is going out. So we really need to discuss this. Now, the other thing that is very important, please be keen. Take notes so that we'll ask questions when we come to that part, is that you find when we talk about this treatment and many other conditions that we've done or that affect human beings, there's so much of us taking drugs unnecessarily, without having been tested, without having been confirmed from a medical facility, whether, yes, that you are suffering from this infection, and tests have done to be confirmed, ama umeona daktari. So when we have this program, always, our essence or the reason for this program is that we really want people to do the right thing. Kuenda kwa hospitali, kuongea na daktari, na daktari anasema atafanya test. And these help in getting to confirm what you are suffering from and how it is going to be handled. So the idea of sharing medication should not be here. The idea of telling your friend or listening friends that they tell you this is a problem. The idea of us destroying our own relationships, our own marriages should not come forth. So it is a special condition. In our conditions, we make it very simple. I use terms that are very simple and language that is simple for that we understand. Where there's a terminology or a term that is big, I'll break it down so that we really are able to go together. So I started by saying this is a condition that is treatable. So it means if we follow the instruction very well, then we are able to be assisted. Number two, it means that once we have this infection, we follow up the treatment and follow up and go to the right places. So thank you very much. We start, as always, by what we call a definition. Now, what is UTI? Now, those are just initials. Basically, they mean urinary tract infection. Hii ni ugonjwa ambao ina affect watu wote, wanaume kwa wanawake na pia watoto. But you find we said it's a special dedication to our women, to our mothers and the young girls, because kimaumbile wanawake wameumbwa tofauti na hakuna makosa. The only difference is you find that it really affects more women and the young girls. So what is UTI? Definition of UTI simply means this is a bacterial infection that affects the urinary tract system and the urinary tract systems will have what we call the urethra. It will have the kidneys, and it will be all those parts that come together. So you find that when infection or bacteria comes from outside of the body, and this will come from the skin around our private parts, and also the area, the anal area, pahali choo kubwa inatokea, you find if we are not very clean, then you find the infection around the skin and infection around the anal area will get in what we call the private parts of a woman or a man and cause an infection. Simply, by definition, urinary tract infection is an infection that affects the kidneys, the urethra, and the urinary, what you're calling the urinary tract infection, and it is caused by bacteria that comes around from our skin or the anal area, ile sehemu ya siri ya nyuma. So when I talked about young girls, please mothers be keen. We need to teach our young girls how to handle what we call toiletries, or how to wipe themselves when they go for a long call. We'll go into this in details. Now, when we talk about this condition, I've said that we need to differentiate what we are calling UTI and STD. STD stands for sexually transmitted disease. UTI stands for urinary tract infection. This means mwanamke, mwanaume, mtoto anaweza pata hii urinary tract infection, na si lazima kukue na ile hali ya kuwa na intimacy, especially for the married couples. So when we raise the issue, when I talked about having issues, people saying bibi yangu anaenda nje, bwana yangu anaenda nje, UTI is not a must that you have it from someone out there. As we finish, I'll give you details of what we need to look into, so that as we follow up on treatment, we'll be able to know how to handle it. So the next thing is that we need to have said is that it's because of the way anatomically the woman is created, it will affect more women. Now, what is the next thing that I really need to know? In all our topics, we always talk about what we call signs and symptoms. By signs are those things that I can have and the next person can be able to know that I'm experiencing as a patient. Symptoms are those things that I may have and the next person might not know. I myself feel them, but the next person does not feel them. Now, what are the common signs and symptoms of UTI, or what you're calling a urinary tract infection? Now, number one, tumesema hii ugonjwa ina affect sehemu zetu nyeti, sehemu za siri. So when we talk more about women, you find one of the main signs is that a woman or a young girl or even a man will present with what we are calling discomfort, ama kusikia ile uchungu wakati anapitisha ama mkojo inatoka. They will complain of something called lower abdominal pain. Ile ni hali ya kusikia tumbo ya chini unasikia uchungu. They will also complain of when this condition continues, there might be a discharge ambao inatoka, na hii discharge inaweza kuwa saa ingine haina harufu, lakini wakati inatoka kuna ile hali ya kusikia uchungu wakati unapitisha mkojo. Now you find that a patient, either a man or a woman or a young girl, they will complain kusikia fatigue. Kuna ile hali ya uchovu. They will also complain of fever, kusikia joto. They will complain of nausea. Nausea is that feeling of like vomiting. They will also complain of vomiting, ile hali ya kutapika. And this shows that infection is more or is increasing. They will also complain of what we are calling vaginal irritation kwa wanawake na wasichana. Wana ile hali ya kusikia discomfort. Saa ingine wanaweza sikia mchungu ama muwasho, ama kusikia wako dry, wanasikia hasa wako sawa. They'll also, with severe cases, you find they will be discharged, and sometimes they'll even pass urine that also has some blood stains or blood in it. And these will occur when the infection is more serious or it has not been there. Now, when I started, I also said that now this condition is also a condition that most of us, and especially women, they shy about, and young girls, they feel like they don't want to share. Unasikia aibu kuambia mtu unasikia uchungu wakati nakojoa, nasikia vibaya sehemu yangu ya siri. So please, let's be bold. When you start having those signs, and especially for our mothers, kindly let's teach our young girls or even boys to communicate when they have a problem in their private areas. So it's nothing to be shy about. It's always good that you to know that once you remain with this condition for long, then the outcomes are not very good. So very fast, briefly, for those who are joining us, today we are discussing about a very unique condition. It's a very common condition, UTI, urinary tract infection. Now, is a condition that is affecting all of us, as Magdalene has said, but you find due to the way God has created us, it mostly affects women and young girls. So it's a special dedication to our mothers, our women, and our young girls. Now, it's a condition that also has what we are calling social stigma. You find wakati unasikia uchungu, sehemu yako nyeti ama ya siri, sometimes a young girl or even a young lady or a woman will feel it funny to talk about this, because sometimes as parents, we always look at things in a different way. Unaweza sema msichana wako ameanza kutembea nje, and hasa hakuna kitu kama hiyo. So for the married couples, when we talk about this condition, we also want to encourage that when your partner has an infection or has a complaint, kindly do not judge. The best way to go about it is what we will do next when we follow. Now, this condition, as I've said, it's treatable. Kuna madawa, kuna matibabu. Na if we don't treat it on time, then it can complicate and bring other conditions that are more severe, or even the loss of life in unmanaged cases. So it's always good to seek treatment and to do the right thing on time. Now, the other thing is, I also encourage our women and our mothers, kindly listen and know that you need to teach the young girls. Kwa wakati wanaenda haja kubwa, wanafaa wajipanguze vizuri kutoka mbele kuenda nyuma, kwa sababu wakati wanajipanguza kutoka nyuma kurudi mbele, hasa ile uchafu ya choo kubwa inaweza ingia sehemu ya siri ya mtoto msichana, na inaweza mfanya apate infection ya UTI, or what you are calling urinary tract infection. So this is a condition that we really need to be keen about, and in most hospital setups or clinics you find is a common condition that madaktari kila wakati wanapata watu ambao wanapata hii infection. Now, what is the definition of UTI? Those are initials that mean urinary tract infection, and simply without using big terms, this is an infection that affects what we are calling the urinary tract system. Na kuna figo, kuna ile tunaita urethra. Urethra ni ile mpira ambayo inatoka kwa figo na inatoa mkojo nje. So the bladder also is where the urine is stored. So this is a condition that affects those three organs. Now, when we get these conditions, what are we supposed to do, or what do we need to know when someone suspects that they have this infection? We remember now, for the married couples, we said when we get these conditions, please kindly do a follow-up. Go for a check so that you are advised. Now, what are the signs and symptoms of this condition? Now, I've started by saying that sometimes you find wakati hii ina involve pia wanaume na pia watoto na pia wanawake. Wakati mwingi mgonjwa ama yule ambaye anahisi anasikia uchungu wakati anaenda kukojoa, anasikia tumbo ya chini ikiuma. Wakati mwingine kuna ile discharge ama kuna ile uchafu ambao inatoka, inaweza kuwa clear, inaweza kuwa iko na tofauti kidogo. Ana ile hali ya kusikia fatigue ama uchovu wa mwili. Wakati ambao mtu wako mgonjwa huwa anajihisi hayuko sawa. Kuna ile hali ya kupata ile tunaita fever, the temperatures rise up, so there is also what we call body malaise, hii hali ya kusikia uchungu wa mwili. Now, someone will also complain when we are talking about married couples and we talk about intimacy. You find that when there is intimacy involved between a man and a woman, mostly you find the man and the woman will complain of pain, and especially the woman. Wakati kuna ile hali ya kuonana kimapenzi, mwanamke anasema kuna ile hali ya uchungu. So you find that the other thing that I want to mention as an addition is that when you have UTI, kuna ile hali ya kusikia kuenda frequency, kusikia kuenda choo ama kusikia ile hali ya kuenda kukojoa, na wakati unaenda unasikia kuna mkojo. So unajihisi kila wakati unataka kukojoa, lakini saa nyingine wakati unaenda haja ndogo hakuna ile mkojo. Now, there is also what we are calling vaginal irritation. Kuna ile hali ya kusikia discomfort kwa sehemu nyeti, sana sana kwa wanawake na pia kwa wanaume. Kuna ile hali ya kusikia nausea, kusikia kutapika, ama ile hali ya kutapika kwenyewe. Wakati mtu unasikia unatapika, ama mtu anasikia asikii vizuri. Now, what is the next thing that we need to learn about this condition? This is not a very big topic, but it's a very important topic. Now, number one, I said the issue of self-treatment or self-medication, the issue of sharing treatment, the issue of looking at alternatives that are not good, the issue of looking at cultural aspects. We've gone to school, we are a bit educated, we need to merge the idea of education into being and do the right thing. So wakati na hizi signs, ama my partner, ama mtoto wangu anakuambia mami ama dadi nasikia vibaya, the next thing is go to your nearest facility. It can be a clinic, a medical facility, a private one, or a mission one, or even a government one. Wakati unaenda huko, mnaongea na daktari, be confident. If you're a young person, kindly be confident, because the more you keep quiet about this condition, then it means that it affects you more. Now, elezea daktari kama uko na hizo signs za kusikia uchungu ukikojoa, za kusikia kukojoa ama ile hali ya frequency kukojoa sana, kusikia mgongo pia ikiuma, kusikia tumbo ya chini ikiuma, kusikia fever, is all the signs that I've mentioned and many others. You find wakati umeongea na daktari anakuadvise na anakuambia kwa hizi signs we need to do some tests, we need to do a physical exam, a head to toe exam, na ujuzi wa madaktari ama wa daktari itasaidia hasa kuelewa ni nini. And through a test it will be confirmed. And normally daktari may request for what you are calling urinalysis ama ile hali ya kupimwa choo ya mkojo. So wakati daktari anapima, then atajua kweli uko na hii UTI na ataconfirm kuwa kama ni partners hakuna mambo ya STD, ile tulisema sexually transmitted disease. Na wakati amejua hivyo, kuna matibabu. I don't want to go into details of treatment, because the idea is once we get these signs, let's go to a nearest facility, let's seek treatment, na wakati tunapewa madawa tukunywe dawa vizuri na tufuatilie maagizo ya daktari. Now, what is the next thing as we come to a close to a topic so that we go to the questions part? Now, number one, hata wakati kuna matibabu, kuna mambo muhimu sana nataka tuongelele. You remember I mentioned about young girls and the importance of the mothers to teach the young girl. Wakati wanaenda haja kubwa kujipanguza choo, kutoka mbele kurudi nyuma, si kutoka nyuma kukuja mbele. Hii ni kwa sababu wakati msichana anapanguzwa choo, ukimpanguza kutoka nyuma kurudi mbele, inamaanisha choo ambayo imetoka sehemu ya nyuma inarudi inaingia sehemu ya siri ya mbele. Meaning, you remember in definition we said simply UTI means a bacteria or what we are calling microbes. Uchafu kuingia sehemu ya urinary tract systems, and this is what we are calling the urethra, the kidneys. And one, wakati uchafu inaingia, then inatoka kwa sehemu ya nje, kwa ngozi ambayo iko karibu sehemu ya siri ama sehemu ya nyuma ya choo. So this brings about this infection. Now, key points that we need to listen. Please take your pen and paper. Number one, hygiene is of importance, and this is for men and women, and more so for women. Hali ya kujiosha sehemu ya siri ni muhimu sana, and it's advised that for women and young girls and wasichana wadogo, hali ya kuoga inafaa kuwa at least mara 2 kwa siku. Wakati mwanamke ama msichana anaoga, akioga mwili, sehemu ya siri unatilia maanani kabisa, na usitumie sabuni. When you use soap, any detergent, the mentality of us human beings is that when we involve soap in many things, it means the part that we are cleaning is more clean. Mungu ametuumba tofauti, especially wanawake. So wakati unatumia sabuni sehemu ya siri, inamaanisha unaenda against ile mambo Mungu ambayo anataka, because ameumba kila kiungo na njia yake ya kujiosha. So when we involve detergents or soaps or even powders or perfumes, you find they alter or they change, and this predisposes ama hii inaleta ile hali ya mwanamke ama msichana kupata infection. Now number 2, tumesema number 1 ni usafi na ni mara 2 sana sana kwa wanawake. Number 2 tumesema kutotumia sabuni sehemu ya siri. Number 3, and this is very important, and we said we need to be bold because we need to talk about these things. Number 3, ile nguo ya ndani, ile nguo ya innerwear, ile tunaita panty. For women and young girls, we encourage that they wear what we call cotton material. Why cotton material? Cotton material inapumua, inaingisha hewa, inatoa. So wakati tulisema hii infection inatoka kwa ngozi ama sehemu ya nyuma ya siri ama nje, environment ya nje. Wakati kuwa na joto ama unatembea sana, ile jasho inaweza ingia sehemu ya siri, uchafu ya nje itaingia sehemu ya siri. So when they wear our ladies and our young girls wear cotton material, innerwear cloth, you find that cloth breathes and brings about aeration, ama ile hewa kuingia na inafanya hiyo area ikue dry. Now, number 4, choo ambao tunatumia, either ni choo yako kibinafsi, choo ya familia ndogo, ama choo ya watu wengi. Please hakikisha as a lady, and when we talk even going out to a restaurant, please make sure kama choo si safi, osha vizuri. Sana sana we advise the use of a toilet that is flat, ile choo ya chini, because ile ya kukalia ujui ni nani amekalia, na kama ni lazima ikue ni hiyo, ikue imeoshwa vizuri na inaoshwa at least mara kadhaa kwa siku. Now the other thing is we also advise the intake of water. Wakati una infection ya mkojo na ukunywi maji ya kutosha, it means that the bacteria infection will become more because the urine is concentrated. Na pia mkojo ni ile hali ya uchafu ambao inatoka ndani ya mwili kuenda nje. So we need to follow those guidelines, and these will go overboard. Even when we talk about treatment, they will help in making sure that you don't get a recurrence, and then you make sure that you stay well and you stay clean and you stay healthy. Now, the other thing, as we come to an end, they are culturally from where we come from, watu wanasema tunatumia hizi vitu. Now, these things that we use as alternatives, they are not treatment. So, matibabu ni ile ya daktari kutokana na kipimo na results zake, na anakuelezea ile instructions ambao utakunywa dawa, na sometimes ata encourage urudi kwa muda ili kurudia hiyo test kuhakikisha kuwa hii UTI imeisha ama infection ya mkojo imeisha. So kuna vyakula ambao ni muhimu sana ambazo zinasaidia, and I'll just mention a few of them. We said water is important. Of course, when you are sick, you need to eat a healthy diet ambao ni vegetable and fruits. They help in healing, na zinasaidia pia mwili kuwa na kinga nzuri. Now, the other thing is we encourage women and all of us, and especially women and young girls. Yogurt ni nzuri sana. Tusitumie yogurt ambayo iko na sukari mingi because inaongezea kilo. Hii inasaidia kuimprove ile hali ya sehemu ya siri. Iko na kitu inaitwa lactobacillus. Na lactobacillus is a fungus ambao husaidia kuweka ile sehemu ya siri kuwa healthy na kuzuia infections zozote ambazo zinaingia sehemu ya siri. Now, number 2, you find things like lemon are good to drink. Things like ginger in our diet also help in preventing these infections. So intake of a lot of water and following the hygiene rules and making sure the innerwear is cotton material, choo safi, na kutotumia sabuni sehemu ya siri. So I wish to stop there, and we are most welcome for the questions that will follow after us listening.
Kile ambacho tunazungumzia siku ya leo, UTI. Daktari, so many young girls have this shyness when, for example, they suspect that they have a problem with something in their urinary tracts. They fear to talk about it. What would you advise young girls and even women in general? It's a discussion they wouldn't want to go to anyone to say, I have a problem.
Thank you very much, Magdalene. That's a very good question. Now, when a young girl is growing up, there's so much that she does not know around about the world. As parents, we need to raise our children in a Christian way and with what we call communication, whereby mambo ya kanisa, mambo ya dunia ni lazima tuongee, na mambo ya dunia ni muhimu sana, because when we talk about some of the issues that affect us, are those issues that really people they shy away, they don't want to talk about. Let's, as parents, and more so for our mothers, because I said it's a dedication for our women and our young girls, let's be encouraged to raise our children in what we call communication. Ile hali ya kupendana na kuongea pamoja, and train them to never shy away. Whatever a big problem, an elephant it is, let's open communication so that when there's a problem, the young girl will not shy away or will not keep quiet. So I encourage that there should be communication between us as parents and our young girls, so that we open that way of making sure that problems are not kept quiet about, and problems do not become mountains because someone somewhere is uncomfortable, is feeling shy. So we need to encourage our children to communicate and never to keep quiet when there are issues that involve their health, no matter where or which part they are affected. Thank you, Magdalene.
There's another question here from Mary. Mary is asking, does it mean if I get a UTI, every UTI I must go and see the doctor? Can I do self-medication?
A very nice question. Now, number one I want to ask Mary is, how have you known that is an UTI? Because the other thing that I wish to add, you remember I said that this is a condition, if it's not treated, it can go out to be to bring a bad outcome. Now, the essence of our program, Mary, and to all of us who are listening, is that when I have a problem, there are so many other conditions that may present. You remember I talked about last week but one, we talked about candidiasis. It's also an infection that affects mostly women. Na ina affect ile sehemu nyeti ama sehemu ya siri. So it can present the same way with the same signs. Ile hali ya kusikia discomfort. How will you be able, Mary, to differentiate? And for all of us, that it's an UTI or not. Now, what we encourage, and I remember when I finished, I said there are things that we can take, like ginger lemon. Yes, you can take these things, but when you feel they are not improving, the best thing is to go to your local daktari, your friendly daktari, and when you share what you are feeling, then they will be able to advise in the best way. Thank you for that question.
The other question is coming from Jane, and Jane is asking, how can the men support women or their wives, especially if the man discovers that the wife or the girlfriend has a UTI?
A very good question. Now, outcomes of UTI. Outcome, I started by saying it is a treatable condition. Now, what happens if you don't go for treatment, if you are not able to be realized this is what is affecting you? It means this condition affects the kidneys, it affects the urethra and the urinary tract system. So kama hii shida itibiwi, hii shida itaenea na itaingia mpaka kwa figo na itakose shida zingine. Now, coming back to the question, it is very important for us men to understand the best gift in life is trying to understand an issue or trying to understand something. If someone presents you with a question or if someone presents you with some certain things, a lack of knowledge has made us make very poor judgment and make us make or decide on what we are calling make decisions that are very poor. So the best way I encourage is that kama mimi ni mwanaume na bibi yangu anapata hii shida, the best way ni vile tumesema muende na yeye pamoja, because now even UTI and other infections, they can also affect the other partner when we are talking of a married couple or what you're talking of intimacy. So it's always good for the men to be strong, to be supportive, and to be there for the women and to listen. And since they are not medics, the best thing is for them to go to a health center, na wakiwa pamoja na support ya bibi yake wamsaidie, na daktari atawapatia mawaidha ambao itawasaidia wote wawili. Thank you very much.
Daktari, there's also another question here. You talked about the use of soap. Mimi nimezoea kuoga na sabuni na naosha kila sehemu ya mwili yangu. Could you just repeat, does that affect my system in any way?
Thank you very much. That's a very nice question. You remember I said when we involve soap in our cleaning, we have the idea, and of course it's always right, that sabuni inaongeza ama inanufaisha usafi. Now, this is not true when we are talking about ile sehemu nyeti ama sehemu ya siri. Mungu ameumba sisi binadamu na sana sana wanawake. Medically there is a term or there is something we call normal flora. Now, normal flora means simply kuna zile bacteria, kuna zile organism ambazo Mungu ametuweka kwa mwili yetu, na hizi si ambazo zina cause infection. Hizi huwa zinakinga mwili. So there is certain normal bacteria and microorganisms ambazo zimewekwa sehemu nyeti ya mwanamke, ya sehemu ya siri, na kazi yake ni kuosha hiyo sehemu ya siri. So wakati unatumia sabuni na unaingisha ndani sehemu ya siri, inamaanisha unaenda against kimaumbile. And what will happen, you clean out that normal flora, the normal healthy bacteria, the normal microorganisms, and these will make you susceptible, ama itafungulia njia magonjwa ama bakteria zingine ambazo si nzuri. Na tulisema infection, bakteria zinatoka kwa ngozi na sehemu ya choo ya nje. So now it will welcome to people who are not friendly, and these are now what you are calling the bacterial infections. Thank you.
You can see online here we have Peggy. She's saying, I'm following you all the way from Babadogo. Asante Daktari. Then there's also Agnes Kavenge. She's saying, Daktari, I'm feeling blessed together with our sister Magdalene and you there. Thank you very much.
Thank you.
Yes. So basically, we are talking about urinary tract infection, and what Daktari is saying is that some of these things people fear to talk about because you feel shy and you're not so sure what will be the reaction of the other person. But what he has said is that there are key things we must do, especially our hygiene. We ensure that we shower. Kuna watu wapendi kuoga, Daktari.
Yeah, very true.
Sijui ni mawaidha gani utawapa.
Yes, number one, usafi wa mwili ni muhimu sana, na wakati mwili ya mwanamke ni tofauti na mambo mingi because wamebarikiwa na ile hali pia kutubariki na watoto. So ni mwili ambao ni lazima sana tuangalie. Wakati mimi siogi hata kuwa kama niko mwanaume, kitu ya kwanza ni kuwa napea ruhusa bacterias na uchafu ambao tumeongelea kukaribia mwili yetu, na sana kukaribia zile sehemu za nyeti. So when as a woman or even as a lady, I am not hygienic, and this is not even women, even as men, you find one of the things that we open doors for those neighbors that are not friendly, and these are now infections. So hali ya usafi ni muhimu sana, hali ya kutumia pia vitu safi kama choo vile mention, hali ya kutumia nguo za ndani ambazo ni safi, and I've insisted that for our women, the innerwear should be a cotton material. Now, the other thing I wish to add is that we are busy during the day. When a woman cleans herself in the morning na anajipanguza na kuwa dry, anavaa ile nguo ya cotton material, innerwear. Ikifika jioni aoge tena na aitoe na alale bila hiyo nguo. Because we need that environment aired, ili hewa ingie vizuri. So, innerwear should be worn during the day. At night, we need, once you clean the second time, then unalala na nguo loose ambao haujavaa ile nguo ya ndani. Kupatia mwili nafasi kupumzika na hewa kuingia vizuri. Thank you, Magdalene.
Kuna swali lingine hapa. Kuna rafiki yangu alikuwa na UTI na daktari alimwandikia madawa. Naweza tumia hiyo prescription yake na mimi niende ninunue hizo dawa endapo nasikia sisikii vizuri?
A very beautiful question, and thank you for the person who has asked that question. Now, number one, when someone is sick, this is what we call kuenda kwa hospitali na daktari kurecommend test ama physically anajua hii shida ni gani, because daktari wana hiyo ujuzi. Now, wakati tunakuja kwa UTI and we recommend kama daktari ile hali ya kupima choo ama kupima mkojo, what I called urinalysis, it gives a result that cannot be similar with someone else. If I have UTI, remember I said it's a treatable condition, but also with long term and no treatment or wrong treatment or kuchia vitu zingine na madawa za watu wengine, it means I can complicate the condition because number one, kama mimi ndio nimepimiwa, hakuna vile kwa dunia result yangu ya choo itakuwa the same na mwingine ambaye unataka kushia dawa na yeye. Hizi dawa hasa ni zako binafsi because zinalingana na ile test ambao umefanyiwa ni daktari, na kwa ile test kitu ya kwanza daktari anajua ni kuwa anajua ni nini ana deal nayo. So anaweza kujua ni bakteria ina gani. Number 2, anajua kiwango, the amount or the level of the infection. So those two things are very important. Number 3, anajua ama kuna shida ingine zaidi. Unaweza kuwa na UTI na unaweza kuwa pia na infection ingine kama candidiasis ambao tuliongelea last week but one. So you can't share drugs with someone else. It's also not advisable to buy drugs over the counter. You need a prescription. Kama daktari ambaye amekuona na amefanya test, niye anafaa kuandikia hiyo prescription ili wakati unaenda kwa chemist ama kwa dawa pharmacy, then unapata prescription ambao inaenda kulingana na ile shida ambao uko nao na inalingana na kiwango ya shida, aina ya shida, and also whether there is any other problem apart from what we are talking about UTI today. Now, when I want to add something as I finish on this question, now the outcomes, there are other conditions that present the same way. You remember I mentioned candidiasis. There's something called vaginitis. Vaginitis means ile hali ya sehemu ya siri kuwa na muwasho na kuwa na uchungu. It will basically present the same as UTI. There are many other conditions that present the same way. So with the signs and symptoms, you remember I never went into detail in terms of treatment. This was very, in a way, not to mention the drugs, because naweza sema madawa na watu waseme daktari alisema hii madawa. What I recommend is you go to your nearest facility and then you are tested and you are able to be told what is there. Lack of follow-up in terms of treatment na kutibiwa on time, prompt treatment. Hii shida inaweza affect kidneys. There are so many cases of people who are going for dialysis. Ni ile hali ya kuosha figo. Some of them may start with a very simple UTI infection. So let's be keen. Number 2, there's another condition I've always discussed in many of our topics when we have here, PID, pelvic inflammatory disease. This is the condition ambao inaharibu hata ndoa ama uhusiano, watu ambao wako kwa doa. This condition means the recurrent of UTI infections or like STD infections ambao either hazitibiwi vizuri ama unashare dawa ama unatumia the wrong treatment ama unatumia rock alternatives are not advised, meaning that hii shida unatibua ama unakataa kutibua vizuri, inapona inarudi. So inamaanisha like for the married couples ama kwa wasichana ama watu wengine, hii shida ikirudi inaharibu your social life, inaharibu what we call your esteem, your social esteem. Wakati una shida moja, mtu anajihisi hayuko mtu na anajichukia. Thank you very much.
Naona kuna maswali hapa. Kuna Edward Ochieng. Edward anauliza, Dr. and Magdalene, good morning. Daktari, I would want to know, what does a change in urine pH mean?
A very nice question. Now, there's in science, most of us, we went to school, we talked of something called the alkalinity or acidity of a substance. There's what we call the pH, is what we call the acidity or the alkaline. Acidity inamaanisha ile ukali na alkalinity inamaanisha iko basic, haina ile ukali. Now, kuna pH sana kwa wanawake na kwa mkojo ambao inafaa kuwa acidic. Na inafaa kuwa around 7.5 kurudi chini. That means hiyo environment iko acidic. You remember I talked about normal flora. Kuna zile bakteria ambazo zinakaa sehemu ya siri, zinachunga uchafu ama infection kuingia ndani. Now, one of these is that the idea or the essence of having an acidic environment kimaumbile inazuia infection kuingia. When it becomes alkaline, it means hakuna ile acid, so uchafu yote inaingia, hakuna ile kitu inachoma hii uchafu in simple English. So wakati tunatumia sabuni, for the person who talked about the issue of using soap, you mean that you are changing that factor, meaning unafungua milango kwa adui. So basically that environment should be acidic, meaning kunafaa kuwa na ukali kidogo, adui yote akiingia anakuta hiyo ukali anatoroka. Thank you.
Kuna swali lingine hapa kutoka kwa mrembo anaitwa Magi. Good morning, Magdalene. Kindly, what if I clean my private parts with lemon, warm water? Can it help to cure or reduce infection?
Now, we remember when we talked about treatment, and I remember adding the idea that we are blessed with education, we have advanced in terms of technology. Yes, some of this method can be used, but wakati unatumia lemon sehemu ya siri na shida imekuwa kubwa, inamaanisha shida ni kubwa kuliko kutumia lemon. Now, some of us, even what we call prophylactically, prophylactic means kuzuia. Like when we put ginger in our meals, when we eat lemon, it creates that acidic environment and prevents infection setting in. So, for that person who has asked the question, which is a very good question, wakati unatumia hii na inakusaidia na hakuna shida kubwa, it is okay. But wakati unaishi, the signs and symptoms are becoming worse, then we need to come up with now another option. And the best option is we have to upgrade. Ni kuenda kwa hospitali na kuongea na daktari, and then everything follows after that will really help you in sorting out this issue. Thank you.
So, Daktari, those are some of the questions from my end.
Yes, thank you.
Maybe just your remarks as we come to the end. I see it's 8 minutes to 9 a.m. Maybe Daktari can give us his final summary as we come to the close of the program for today.
Thank you, Magdalene. First of all, I wish to thank you all for maswali imekuwa mingi sana. When you find questions coming in, it means people have been listening and they have been keen and they have been writing down so that they are able to learn more. You remember always the essence of our program is knowledge. And in all our programs, I've always shared the idea that knowledge is power. When you are knowledgeable about something, remember there's a question that talked about how should men behave towards a woman who has an infection. When we men are knowledgeable, we will not be judgmental. In the social state of our affairs as of present, there's so many things happening around. There's this idea that watu wanatembea nje, watu wanatoka nje ya ndoa. In most cases, it's not a must. So when you are judged, it means you've gone overboard. It means even in alleviating the problem, you've already decided that huyu mtu ako na ugonjwa kutoka nje ama ameonana na mtu mwingine nje ya ndoa. The best way is get to listen, get to go to hospitali, ongeana daktari na atawaambia hii infection haina asa uhusiano wowote, pengine ni choo yenyu inaleta hii shida. Kwa wasichana wadogo, we encourage our mothers to talk to them, have a relationship as they grow up. Let's be encouraged to involve them in getting to understand about the physiological way of the way they were created and what they need to look into. So for that, I wish to thank you all, and let's always have time to learn something new every day. Thank you.
Thank you very much, Dr. Listener, you've been listening to the Health Corner here on 107.3 FM. Thank you so much. I hope you've learned something useful. And even if it's not information that is useful to you, share it with our sisters, our mothers, and anyone around us. Even for us, it's good for us to know our health, because our health is our priority. I want to thank you all for keeping it on 107.3 FM.
Kila walilokata